This is a short anatomy perspective on the rectus femoris muscle. It attaches superiorly on the os coxa, crosses over the femur, and attaches inferiorly on the tibia. This illustration shows how it fits in as a superficial muscle on the anterior thigh. When we look at rectus femoris in combination with the other quadriceps muscles, we can see that the femur is now not just trapped by rectus femoris, but is also the origin of those other vasti muscles. The rectus femoris, which extends the knee and flexes the hip, is not as effective as a hip flexor when the knee is extended, and it's also not as effective as a knee extensor when the hip is flexed. In this lateral view, we get a better look at the upper attachments, which helps us define the two separate heads. The first head attaches to the anterior-inferior iliac spine, and there's a tendon from this that extends into an aponeurosis along the proximal anterior surface of the muscle. The second head, a reflected head, has short tendinous attachments that extends back into the rim of the acetabulum. Then this tendon extends into the center of the muscle for about 2/3 of the muscle's length. Rectus femoris is a primary hip flexor along with iliopsoas. There are a number of other muscles that cross the anterior surface of the hip joint. Here's a medial view of the hip flexors. All of these muscles cross the anterior surface of the hip joint. The rectus femoris is highlighted in gold. In this illustration, from a medial view, you can see iliopsoas, pectineus, adductor brevis, adductor longus, gracilis, sartorius, and of course rectus femoris. And on the lateral surface, which you can't see, would be tensor fasciolata. You can find more in my blog on integrativeworks.com. There's information about the trigger point in rectus femoris that creates pain in your knee and makes it kind of weak and buckle going downstairs. There's also a good bit about stretches and self-care to help you get out of pain and improve your activities of daily living. If you're a therapist, there are some therapy notes out there, and of course, there's this post on anatomy. I'm Tony Preston with Integrative Works.